Bismillahirrahmanirrahim. In today's lecture, we'll discuss the endothelium, that is the third important component of the hemostasis. As you all know from your previous knowledge of histology, that endothelium, it refers to the container in which the blood is transported, or it is the inner lining of the blood vessel and the lymphatics. So endothelium, it is in direct contact with the blood cells and the lymph. So the next important thing about is endothelium is that it maintains the balance between the procoagulant and the anticoagulant activities. And it is the endothelium that determines whether clot formation should occur or not, whether its propagation should occur or not, or its dissolution should occur. So all these are the properties of the endothelium. So there are two main properties of the endothelium. One is anticoagulant and second one is the procoagulant. So if we discuss the properties of the endothelium, they are mainly the antithrombotic properties and the prothrombotic properties. So firstly we will discuss the antithrombotic properties of endothelium. They are the platelet inhibitory effects, the anticoagulant effect, and the fibrinolytic effects. If we talk about the platelet inhibitory effects of the endothelium, that is mainly due to the secretion of few very important factors. And those important factors, they include prostacyclin, that is also called as prostaglandin I2, nitric oxide, and adenosine diphosphatase. This adenosine diphosphatase, it degrades the adenosine diphosphate, and adenosine diphosphate, as you all know, that it is present in the dense granules of the platelets, and it is a very potent activator of the platelet aggregation. Second important thing about the platelet inhibitory effect is that endothelium, it serves as a barrier that protects the platelets from the subendothelial von Willebrand factor and the collagen. When the endothelium, it is damaged, the subendothelial von Willebrand factor and collagen is exposed, and platelets can bind to the subendothelial collagen with the help of this von Willebrand factor, so resulting in the activation of primary platelet plug formation. Third important thing about the platelet inhibitory effect, that endothelium, it binds to the thrombin, and when it binds to the thrombin, it alters its activity. And thrombin, as in the previous lectures, it is a very potent activator of the platelet, resulting in the formation of secondary hemostatic plug or secondary platelet plug. So mainly speaking, platelet inhibitory effects, they can be divided as the endothelium, it serves as a barrier for the von Willebrand factor and collagen. It secretes these three important factors, and out of these, adenosine diphosphatase is very important, and it alters the activity of the thrombin, which is a potent activator of the platelets. So this picture, it shows the various important platelet inhibitory effects of the endothelium. You can see the secretion of the various factors like prostacyclin, nitric oxide, and adenosine diphosphatase, and all of them, they are very potent inhibitor of the platelet aggregation. Similarly, tissue plasminogen activator, that is also secreted from the endothelium, and this TPA, it results in the formation of the plasmin, and that plasmin, it activates the fibrinolysis, or in other words, you can say that this TPA and the plasmin and the plasminogen, they degrades the clot formation. Third important thing to note is the antithrombin 3, that is an antagonist of the thrombin, and this antithrombin 3, it binds to the heparin-like molecule. The heparin-like molecule, they are found on the luminal surface of these endothelial cells. The heparin-like substance, they have the activity exactly like the activity of the heparin. That is, they have an anticoagulant effect. So now this slide, it shows the anticoagulant effects of the endothelium. As you can see, it is clearly mentioned in this slide that there are these 4 important factors that are elaborated by normal endothelial cells, and they have the anticoagulant activities. These important factors, they include thrombomodulin, endothelial protein C receptors, heparin-like molecule. Heparin-like molecule is also previously discussed in the previous slide, and tissue factor pathway inhibitor. Now, how this thrombomodulin and endothelial protein C receptor works, how the heparin-like molecule, they perform their function, and tissue factor pathway inhibitor, we again have to look at the previous slide, the picture which was shown in the previous slide. So the same picture that was shown in the previous slide, and this picture, it is denoting 3 very important factors that are encircled. First of all is the function of the thrombomodulin. This thrombomodulin, it binds to thrombin and results in inactivation. When thrombomodulin is bind to thrombin, thrombin loses its ability to activate the coagulation factors like 9, 10, 11 and 12. And the second important thing, that is the inactivation or the cleavage of the protein C. When thrombin is not activated, it results in the cleavage of protein C. And this protein C, it requires a cofactor that is called as protein S. And this activated protein C, protein S complex, it results in inhibition of the coagulation factor 5 and coagulation factor 8. The third important thing is the presence of these heparin-like molecules on the surface of the endothelial cells. These heparin-like molecules, they bind to antithrombin 3 and result in inactivation of thrombin. When thrombin is inactivated, again the same coagulation factors which I mentioned, factor 9, 10, 11 and 12, they are inactivated. Fourth important thing that was mentioned in the previous slide was tissue factor pathway inhibitor. And this tissue factor pathway inhibitor, like protein C and protein S, protein C, it naturally requires a cofactor protein S. So it results in the inhibition of the tissue factor 7 complex. And remember, this tissue factor 7 complex, it was the initial step in the extrinsic pathway. So all of these factors, they have the anticoagulant activities. Now moving on to the next slide, the fibrinolytic effects of the endothelium, and they are mainly due to this tissue plasminogen activator. Tissue plasminogen activator or urokinase, we studied in the lecture on the coagulation cascade. So in this slide, they show the same mechanism. This result in the activation of the plasminogen into free plasmin. Free plasmin result in dissolution of the clot, the fibrin degradation products, they were formed, dimers आ जाते हैं उसमें. So this is the same slide, the fibrinolytic effects of the endothelial cells. So the previous slides, they showed the antithrombotic properties of the endothelium. And now let's have a brief look on the prothrombotic properties of the endothelium. When we talk about the prothrombotic properties, they are the procoagulant changes and the antifibrinolytic effects of the endothelium. In the next slides, we will discuss these two things one by one. The pro-coagulant changes or the pro-coagulant effects of the endothelium, they are mainly related to the down regulation of the thrombomodulin protein C and tissue factor protein inhibitors. In the previous slide, all of these were told that thrombomodulin, they bind to thrombin. So when thrombomodulin is down regulated, it will not bound to thrombin and thrombin can perform its function. Similarly, protein C and tissue factor protein inhibitors, when they are down regulated, for example, if there is down regulation of the protein C, it will not result in the inactivation of factor 5 and factor 8. And if the tissue factor protein inhibitor that is also down regulated, it will not result in the inhibition of the tissue factor 7 complex. So these procoagulant changes, uh, they basically denote all the previous knowledge that has been studied till now: the coagulation cascade, the extrinsic pathway, and the picture that was shown previously 2 times, that showed the functions of thrombomodulin, antithrombin, heparin like molecules. So the same knowledge that is gathered here in the procoagulant changes. This slide, it shows the antifibrinolytic effects of the endothelium. If you remember the fibrinolysis pathway, the two important things in that pathway, they were the tissue plasminogen activator and the inhibitors of this tissue plasminogen activator, or you can call them as plasminogen activator inhibitors. So the antifibrinolytic effect of the endothelium, that is mainly due to the plasminogen activator inhibitor, which inhibits the tissue plasminogen activator and the urokinase. And when these two factors, they are inhibited, it will not result in the activation of the plasminogen to free plasmin. And similarly, if there is down regulation of the expression of the tissue plasminogen activator, again the plasminogen, it will not be converted into free plasmin, and the fibrinolysis, it will not occur. So again, just a glimpse of the previous knowledge. Moving on to the next topic, quite a small one, that is the hemorrhagic disorders. If we talk about the hemorrhagic disorder, they are usually associated with the abnormal bleeding from the blood vessel wall, and that abnormal bleeding, it may be due to the defects in the platelet function, it may be due to defects in the coagulation factors, the coagulation cascade, and it may be due to defects in the blood vessel wall. So all of these factors, the blood vessel wall or the endothelium, the platelets, and the coagulation factor, you people know that they are the main components of the hemostasis. So if we talk about the hemorrhagic disorders, there are few general concepts or which are related to these disorders, as you will see in the next slide. So mainly these hemorrhagic disorders, they are classified or they are studied as the defects of the primary hemostasis, the defects of the secondary hemostasis, and the defects which involved the small vessels, or generalized defects which involve the small blood vessels. If we talk about the defects of the primary hemostasis, they are usually due to some defects in the platelets, or they may be due to the deficiency of the von Willebrand factor resulting in the von Willebrand disease. Defects of the primary hemostasis, they usually appear as very small, minute hemorrhages that measure 1 to 2 millimeter in the size, and these small hemorrhages, they are called as petechiae. And these petechiae or petechial hemorrhages, they appear in the mucosal membranes, for example, in the mucosa of the oral cavity or in the mucosa of GIT, or they usually also appear in the skin. If the size of these petechial hemorrhages or petechiae, they enlarge, for example, if the size, it becomes slightly larger than 3 millimeter or more, they are usually called as purpura. Sometimes the mucosal bleed, it can be more severe, and it may result in for example, it may result in epistaxis, that is the bleed from the nose. It may result in excessive gastrointestinal bleeding. It may result in excessive menstruation, that is also called as menorrhagia. Thrombocytopenia, that is usually associated with the platelet defects when there is decrease in the number of the platelets due to various conditions. And this thrombocytopenia, it has a very important complication that it usually presents with the intracranial bleed or bleeding in the brain parenchyma. So this intracranial bleed, it is quite fatal, and it has quite high mortality rate. So now let's have some view of these petechial hemorrhages and the intracranial bleed. Picture A, it shows the colonic mucosa or the intestinal mucosa, and you can see these small reddish dots or reddish minute hemorrhages, and these are the petechial hemorrhages. And again, the point to note here is this picture. This is very important. Both the picture A and picture B, both of them, they are quite important from the OSPE point of view, and one of them that is asked in the OSPE examination. For example, the lower picture, the picture B, it shows the intracranial bleed. It can come in the OSPE examination. The type of necrosis can be asked. You people have studied the types of the necrosis, and as you know that the type of necrosis that is present in the brain, that is the liquefactive necrosis. So have a look on these pictures and keep them in mind. They are important from the OSPE point of view. When we talk about the defects of the secondary hemostasis, they are usually due to some coagulation factor abnormalities, and these coagulation factor abnormalities, the patient with these coagulation factor abnormalities, they usually present with the bleeds in the soft tissues or the joints. For example, if there is bleeding in the soft tissue, it may result in the formation of a large hematoma. If there is bleeding in the joint, it may result in the hemarthrosis, or hemarthrosis you can call it in simple way as bleeding in the joint. And these bleedings, these muscular bleedings or the joint bleeding, they can occur even after the minor trauma. And third important thing is written here, that is the intracranial hemorrhage. Again, the intracranial hemorrhage, if that is associated with the coagulation factor abnormalities, it may be fatal and can result in the death of the patient. So these are the defects of the secondary hemostasis, which are mainly due to coagulation factor abnormalities. So moving on to the last slide of the lecture, and this slide, it shows the defects which involve the small blood vessels. And these are the three important examples: ecchymosis, palpable purpura, and hematoma. Purpura, as you previously studied, that these are the petechial hemorrhages which are more than 3 millimeter in size. However, if we talk about the palpable purpura, they become so much enlarged that they can be palpable with the thumb or finger. Usually the palpable purpura, it is present on the skin surfaces. And in the same way, ecchymosis, you can call them as a bruise or contusion. These are again the hemorrhages which have attained the size of more than 2 centimeter or so. These ecchymosis and the purpura, they usually represent some systemic disorder. While if we talk about hematoma formation that occur due to some local trauma. So hematoma is due to some local defect in the blood vessel, while ecchymosis and purpura, uh, they are due to some systemic disorders of the blood vessels. So this was about the functions of the endothelium and a brief overview of the various hemorrhagic disorders. Hemorrhagic disorders, if we talk about these hemorrhagic disorders, their definitions, they are more important. Like in the OSPE, we can ask you define petechial hemorrhages, define epichemosis, what is hematoma, what is hemarthrosis. So ये एक एक नंबर की definition ज़्यादा important है if we talk about the hemorrhagic disorders. So in the next lecture we'll discuss the most important topic, that is the thrombosis, how what are the various factors which are involved in the thrombosis. So till then, take care and Allah Hafiz.